Hello, I'm Sana Khan, and you're watching Medicircle. Today we have with us Nafeesa Ali
Hello.
Kotwala, experienced director with a demonstrated history of working in the health, wellness, and fitness industry. Please welcome her to our show, Rendezvous on Patient Safety series. Hi, Nafeesa, how are you?
I'm fine, Sana. How are you?
We are good, fine, ma'am. Thank you. Okay, so to begin with, patient safety is a global health priority, hence proved by COVID. What are your thoughts on the same?
Yes, Sana, I'm agreed with patient safety is a global health priority. Actually, if you see the patient safety is not a one day or short time job. It
Mhm.
takes year for us to adopt proper method and to we have to create a culture, safety culture,
Right.
so that we can create awareness. And nowadays, due to COVID, there are few aspects like using of mask while having cough and cold was mandatory, but
Mhm.
we were not taking into the account. But now everyone is wearing it is
Right.
because they wanted to prevent ourselves or the others. And
Right.
the second thing is like the hand wash technique. So normally it in our training we create awareness in the hospital that each and every staff, including housekeeping staff, should know about the proper method of doing it. Now the entire world is following the guidelines. So this proves that patient safety is now the global health priority.
Right. Okay, the theme for this year's Patient Safety Day is Safe Health Workers, Safe Patients. What is your contribution towards the safety of the health workers?
See, being a healthcare service provider, and from last 4 years, I am into the quality accreditation. So
Mhm.
my first contribution towards the providing the safety, I'm providing the safety training, and we are creating awareness among the staff for using the PPE kit.
Right.
Not only using the PPE kit, but also wearing and removing in the correct method. That also helps in preventing infection. Then we are training the healthcare staff for pre and post prophylaxis.
Mhm.
First, we try to prevent the staff that they should not expose to any infection. But in case if they expose to the infection, then we provide the method, or we provide them, educate them the proper technique. Like if suppose they got a neuralistic injury or something, so what they have to do next so that they cannot, be panic, and they have a mental setup that what they have to do if suppose they get a exposure. Then another thing is we make a safety policy. We insist in implementation of and adopt an effective resources, like we advise hospital management to keep some budget for patient safety, like procurement of proper wheelchair, a stretcher with safety belt, side railing, etc. Because many times this create accident.
Right.
Patient get fall from the wheelchair. So, and the another things we insist management to place handle or bar in the toilets and
Right.
the side railing on the staircase to avoid fall. And another is like use of fire alarm, fire safety devices, so that in case of a fire emergency, so they should have a proper equipment so they can avoid further damage.
Right.
Then we also insist the hospital management to keep some budget for safety training for the staff, because safety training is very important. If they know what to do next, then they can avoid major casualty. And we appoint a safety officer also. Hello,
Yes, ma'am.
can you hear me, Sana?
Yes, yes, ma'am.
So we appoint safety officer in each and every hospital when we provide a NABH consultancy or quality consultancy.
Right.
So, and another thing that we provide a mock drill, fire mock drill training, so
Mhm.
that in case if there is any emergency, so they should know that how they have to, escape and avoid the major casualty.
Right. Okay. As you know, ma'am, the digital age and healthcare is highly influenced by technology trends. How do you think this transformation will support patient safety today?
See, one thing though, we all aware that telemedicine and consultation, it was implemented I mean, from almost a decade
Right.
ago. but it was underutilization.
Right.
Now, after this epidemic, the people realized the importance of telemedicine,
True.
teleconsultation.
True.
The good part of this is that we can minimize, like if the patient and especially the children, we minimize unnecessary risk of getting infected
Right.
where there is a low immunity.
Mm-hmm.
So through this like it's a boon for us to minimize the risk of infection. And
Right.
another is like it is very easily accessible. You don't have to travel, and it's in a one click of button you
Right.
can see your consultant. And there are normally many gadgets also where the consultant can monitor the BP, can take a ECG also. So that's now the telemedicine and this healthcare technology is very advanced.
Right.
And what I feel, Sana, that there are lots of scope in implementation of AI, artificial intelligence in
Right.
healthcare. So if we have a software where we can track the patient, we can follow up after the discharge from the hospital, and we can provide them the diet regime, their
Right.
medication instruction. So then the recovery will be more easy, and after discharge also we can provide the proper consultation to the patient,
True.
and that is also one of the part of patient safety.
Right. Uh, Diagnostic errors, identified infections, medication errors, readmissions, wrong site surgeries, and communication are the major patient safety issues. So, how do you ensure proper patient safety in these situations?
See, as an NAPH consultant, normally wherever the hospital I am providing this quality consultation, we keep a record of indicator.
Mhm.
So all this comes like diagnostic error, then HAI, medication errors, readmission, wrong surgery. So these are on the form of indicators, and these indicators we capture either through the register form or Excel sheet on daily basis. Okay, we keep a track of each and every patient's on a daily basis. If
Right.
for a wrong side surgery, we implement WHO form for each and every surgery patient,
Mhm.
and we monitor patient for 30 days. So for surgery patient we monitor, we have a patient surgery assessment sheet for 30 days for normal surgery, and for implant surgery, that is for we monitor for 90 days. And we have a committee, safety committee. These indicators is discussed in the committee, and if suppose there is any error, so we ensure to implement proper kappa to minimize or eliminate the above risk.
Okay.
And regarding communication, we insist for a proper handoff in detail. We insist for the healthcare workers to provide a proper handoff to the other shift people. So, and a legible writing so that there is a nil chances of the error.
Okay.
So, if we follow it religiously, if we implement the patient safety protocol, so I think we can reduce the errors, and we can implement patient safety in a very proper way.
Thank you so much, Nafeesa, for coming to our show and sharing your insights and your valuable time to us for our patient safety series at Medicircle. Thank you so much.
Thanks a lot. Thanks, it's my pleasure, Sana.
Our pleasure to ma'am. Have a good day.